Hello everybody, this is TJ and I'm going to perform IV start. First I'm going to go through my 11 medication rights and my general principles and safety practices. I'm going to verify the order, identify the patient, let the patient know what I'll be doing, apply PPE if indicated, and perform hand hygiene while entering the room, and put my supplies on the bedside table. So I'm going to start by checking my bag of fluids here. When giving a bag of fluids, I'm going to make sure there's no known allergies for the patient when given an IV medication. And then I'm going to position the patient to where I can go ahead and perform my skill. And I'm going to start by, like I said, checking my fluids, make sure there's nothing abnormal about it. Check the expiration date. Doesn't seem too abnormal. Looks normal to me. Expiration date. It's not expired. And I'm going to go ahead and prime my tubing for that. I'm going to perform my hand hygiene and go ahead and spike the bag so it'll be ready when I go to insert the IV cath. So, got my gloves on. I got my line closed so it don't leak everywhere. All right. Go ahead and twist this off. Okay. I'm going to go ahead and spike my bag. Okay. And my line is closed. I'm going to go ahead and get about halfway here. Okay. And I'm going to prime my line to a slow drip so I don't go everywhere. Okay, get all the air bubbles out. Do it nice and slow. Okay, and all the air bubbles are out. Okay, I'm going to go ahead and hang this up on my pole here. So that is ready. Make sure this is up. Okay, got that hanging right there. And then I'm going to go ahead, don my gloves, perform hand hygiene, and palpate the skin of the patient. Figure out what vein I want to do. I'm just going to say I'm in the right AC. And I'm going to go ahead and tie this tourniquet on 3 or 4 inches above the insertion site. So I'm going to do that like so. Okay. Got my vein. I'm 3 to 4 inches below. I'm palpating the skin. Okay. I got my needle already. I'm going to perform hand hygiene, don gloves, and I'm going to go ahead and go about it. Okay. And before I tie the tourniquet on, I'd go ahead and cleanse the skin if it's notably soiled. I would go ahead and do that already and cleanse the skin with chlorhexidine and let that dry. So before I do the insertion of the catheter, IV catheter. So got that. Skin is clean, tourniquet's on, got my gloves on. I'm gonna hold 2 inches below the insertion site to hold the skin taut at a 10 to 15 degree angle. And I'm gonna go ahead and insert. I got blood return. I'm gonna stabilize. I'm gonna go ahead and take my tourniquet off. Okay. And then I'm gonna kind of feed my catheter through. and stabilize my cath. I'm gonna go ahead and hit the safety switch on there. I'm gonna hold above the cath to stop the blood from rushing. So I'm gonna go ahead and do this right here. I'm gonna stabilize the catheter with tape. And I'm gonna go ahead and hook up my J-loop here as well. I'm stabilizing. Okay, and I got that on there, nice and good. And I'm gonna put Tegaderm over it. Before I put Tegaderm on, I'm gonna put a barrier cream before I apply Tegaderm. So go ahead and do that. So applied my Tegaderm here. Got my cream on there. We don't want to rip skin off. Do it like this. Okay, I'm gonna pull the little paper flaps off. Okay. So next thing, I'm gonna go ahead and flush. Sometimes you'll see blood through this little line right here, this J-loop. So I'm gonna get a flush here, and I'm also gonna check for patency too. I'm gonna push a little bit in, check for patency. That looks good. Aspirate a little bit, and then flush. Okay. So went ahead and flushed my line. My main line of fluids is already primed. I'm gonna go ahead and hook that up. So get that. Might not have enough slack. I'm gonna scoot over a little bit. Okay. So now got my patient hooked up. Counted the flow rate. It's being gravity fed. I'm gonna go ahead and roll up on my clamp here and let this go through the patient and do that. So got that going through. Got my patency when I used my flush, and I flushed the line. There's no kinks in the line or anything like that. I'm going to clean up my mess and document my IV start, and I'll do my daily rounds on my patient to make sure how they tolerated the procedure, and I'll document and record what I just did. Thank you.